Hi, I'm Dr. Shawn Thistle, founder and CEO of RRS Education. Thank you for joining us for this new e-seminar called All Aboard the Pain Train, a chiropractor's guide to chronic pain. Just a bit of housekeeping before we get going. Be sure to follow all course instructions and complete all course components and videos in the order in which they're presented. Once you complete the course, you can go back and look at all components and videos at your leisure. You must complete all aspects of this course in order to obtain your certificate of completion. You can complete this course at your own pace. Our system will remember your progress and get you started where you left off. If you encounter any technical issues along the way, please email us at support@rrseducation.com. And if you ever have any questions for me, I can be reached at Shawn@rrseducation.com. Please connect with RRS Education on all relevant social media platforms at RRS Education. As always, this content is based and derived on the consistent, open-minded integration of current relevant research with common sense, real clinical experience, and patient-centered values. At RRS Education, our objective is to enhance and improve our knowledge and cultural authority as a profession while promoting evidence-informed chiropractic patient care that is effective, rational, reasonable, and sustainable. For the first time in the history of the company, I am somewhat reluctantly handing the speaking duties over to someone else, but I couldn't be more proud of the person I'm about to introduce to you, Dr. Dimitri Asimakopoulos. Throughout his short career, he has amassed a wealth of knowledge and information and clinical experience regarding chronic pain and can be regarded as our profession's expert in this area. He's also a wonderful speaker and will share a lot of his personal stories along the way as we go through the massive amounts of content in the chronic pain realm. Staying current on emerging evidence is hard, and we all know that, and it's about striking a balance between what the evidence says, what your clinical experience tells you, and the beliefs, values, and goals of the patient in front of you. Dr. Asimakopoulos will help you navigate this area in the chronic pain realm throughout the rest of this course. Without further ado, it gives me great pleasure to announce my friend and our esteemed colleague, Dr. Dimitri Asimakopoulos.
Thanks, Shawn, for the amazing introduction and for handing me the reins. It's a real pleasure to be here with you guys. I hope that I can use the knowledge that I've amassed over the years and the extensive research that I've done and share some clinical pearls to help you manage chronic pain patients a little bit better. I first want to take an opportunity to go over the course sections with you. The first section is to define what pain is and what we know about it. The second is to understand how to treat the whole person and also to introduce you to the concept of chronic pain phenotyping. The third is how chiropractors can tailor their history and physical examination in the clinical encounter. The fourth is to discuss general principles of chronic pain management that one must use across chronic pain phenotypes. The fifth section is to name that pain and explore various chronic pain phenotypes, which might enable you as a chiropractor to guide your treatment and focus your treatment and evaluate prognosis a bit more effectively when exposed to a chronic pain patient. And finally, section 6 is all about take-home points and a course conclusion. There are 5 learning objectives with this course. The first is to discuss, understand, and apply a comprehensive, evidence-based guide for the assessment, prognosis, and rehabilitation of chronic pain. The second is to use standard pain assessments in relation to clinical case studies. The third is to discuss, understand, and apply phenotyping of chronic pain based on a synthesis of the current research evidence. The fourth is to deliver a primer on chronic pain mechanisms so as to facilitate your understanding of where the different phenotypes come from. And fifth, to acknowledge the role of other healthcare providers in supporting you and your chronic pain patient as you collaboratively treat this patient in an interdisciplinary way. I'll see you all in a moment for section 1. Thanks.